Wake up. It's the Sleep Unplugged podcast, episode 194, Nocturnal Headaches and Sleep. No more pain while you sleep. Welcome, everyone, to the Sleep Unplugged podcast. My name is Chris Winter. I'm a neurologist, sleep specialist, and your host for this episode of the podcast. If you're new to the Sleep Unplugged podcast family, welcome. If you're a veteran, welcome back. We're glad you're here. As always, if you want to get in touch with the show, you can through social media. Dr. Chris Winter, Instagram, Dr. Chris Winter, Twitter, Blue Sky, Threads. We have a YouTube page dedicated to all the videos of the content. And we have a dedicated web page for the podcast. That's sleepunplugged.com. This week, we don't have a sponsor, but we have exciting news that Sleep Reset is going to be sponsoring all of our insomnia content first Monday of every month for the next year. So we're really excited to have them on board. Wonderful company. They've sponsored episodes in the past, and they said, hey, we want to be a more permanent fixture on the podcast. And we're really excited to have them because every episode of the podcast that talks about insomnia generally leads back to good insomnia care, CBTI, and that's what Sleep Reset's all about. So since we don't have a sponsor this week, we will do some comments, corrections, criticisms. This is a comment from the Catnip Life. This was a comment we found on our YouTube page. It said, I just got diagnosed with PLMS. Recently had an in-lab study and I had 72 leg movements in 3.5 hours of sleep. My iron labs showed a ferritin level of 147, so I will start medication next week. I already don't take any of the meds that can be a problem and low caffeine alcohol. Basically, all of my lifestyle modifications are already in place. I was known as a kicker in bed as a kid. I'm now 64 years old. Despite the restlessness sleeper rep as a kid, I don't really have many sleep issues until about 5 years ago. I'm really wondering why now, what triggered this. One morning last week, I woke up with super sore hamstrings and glutes, like I did a workout the previous night. So this is referring back to the episode we did, episode 190, I think, restless leg syndrome shakeup, where we talked about the updated criteria for treating restless leg and how we're moving away from the dopamine agonist more in favor of gabapentin. Well, Catnip Life, thank you for commenting on the show and writing in. I don't have an answer for you. That dopamine dysregulation is a bit unusual. It may take time for these things to develop, but as you're describing, you don't have a lot of secondary reasons for your restless leg syndrome, which is why we would call probably what's going on with you primary restless leg syndrome. Now, could be nocturnal leg cramps and other things going on. So be sure you talk to your doctor. But the short answer is we don't have a great explanation as to why restless leg doesn't really rear its head until people get older. But it is interesting that in a lot of patients with restless leg, you can trace it back to when they're young. So there may be things going on that are exacerbating that. So please talk to your primary care doctor, reach out to a sleep specialist for more help. And you can refer to Dr. Andrew Spector's amazing book, Navigating Life with Restless Leg Syndrome, if you haven't already. I'll do one more comment, correction, criticism. This was from Harry Swain, who contacted me through my LinkedIn, which you can too, although I don't have a lot of patience for LinkedIn. Maybe I'll do a bonus podcast episode of my LinkedIn grievances, but whatever. So, but Harry Swain's a wonderful guy. I met him when I used to do some work for the Baltimore Ravens. He was in their front office. This guy, Rutgers football player, had I think like a 15-year, 13-year career in the NFL, a 14-year career with the NFL. Actually was one of the few people in history, I think, who actually started for three different Super Bowl teams: the San Diego Chargers, the Denver Broncos, and the Ravens. And then he actually also three-time Super Bowl champion. He won two with the Broncos. So just an amazing guy. And he basically said, I saw your video of you bench pressing 300, and I'm sorry, Chris, but if you were in the NFL, we couldn't count it because your butt came off the ground. Okay, I'm sorry, came off the bench. To which I replied, thank you very much, Harry. I determined that about 275 was my limit for lifting with my butt on the bench. But I said to him, my criteria going in for the 300-pound bench press was I'm going to try to do it without hurt myself. I'm going to do it substance free. Obviously, I didn't take any performance enhancing drugs or anything like that. I'm super against that kind of stuff. And beyond that, it was sort of an any means possible. You can butt off the ground, quickly down on your chest and up. As long as it touched my chest and got back up on the rack, I counted that. So I appreciate that. And if I try out for the NFL, I will make sure I represent my bench press max at 275 and not 300. But hey, maybe one day I'll be able to do it with my butt on the bench. So thank you, Harry. Harry's an amazing, amazing guy. If you ever have a chance to hear him speak or be around him, I would highly suggest it. So moving on to the episode this week, the musical reference in the title, No More Pain While You Sleep, are actually two lyrics from songs by the group Badfinger. Badfinger, the Welsh group that was the heir apparent to the Beatles. I took two of their songs. The first one was a song off of their second album, Magic Christian Music, called Walk Out in the Rain. And there's a reference to No More Pain in that song. That was their second album. It was their first under the name Badfinger. It was produced by Paul McCartney, as well as Tony Visconti, who was the longtime David Bowie producer. And they switched their name because I can't remember the Eves or something. I can't remember what their original name was. It was like the Eves or something. And the record company Apple didn't like it and said, we suggest you change it. And I believe somebody said, why don't you call yourself Badfinger, which was a reference to the song With a Little Help from My Friends, a Beatles song. The working title of that was Badfinger Boogie, because apparently John Lennon hurt his hand, and as he was playing the music for the recording of that song, was only using one finger, so it became Badfinger Boogie. But then it became With a Little Help from My Friends. And the group said, "Okay, we'll call ourselves Badfinger." The second song is a song you might be more familiar with, Day After Day, a 1971 song off their fourth album, Straight Up. This was produced by George Harrison and Todd Rundgren, who produced a whole bunch of people, Meatloaf and The Tubes and Patti Smith, and I think somebody else had been kind of big, I'm forgetting. But Todd Rundgren had his own big recording career as well too. So Badfinger was Peter Ham, Tom Evans, Mike Gibbons, and Joey Molland. They also had a song Without You that was a minor hit, but then Mariah Carey recorded it and it was a huge hit. So they have a lot of great songs. Baby Blue, remember the very final episode of Breaking Bad? Baby Blue was the song that plays out the entire series, and it's almost like it's written for the show. Badfinger was probably the most unlucky, tragic group ever. Got really swindled by a lot of people, lost a lot of money. Two of the four originating members, Pete Ham and Tom Evans, died of suicide because of just losing all of their money, and it just, but kind of through no fault of their own. They were just really, really taken advantage of. Mike Gibbons actually died several years ago. He lived kind of near Orlando, Florida, I believe. And then I'm recording this episode on March 1st, and Joey Molland, the original member of Badfinger, died today, a year ago, March 1st, 2025. So we'll put some Badfinger on the Spotify Music Playlist Volume 4. Check them out. Really great, great band. So this episode was the suggestion of a listener who's close to the podcast, who was kind of having nocturnal headaches in her sleep, and said, what's going on here? And as a neurologist, so again, to kind of reset things, I am a neurologist who specializes in sleep, but I did a medical internship and then a full neurology residency at the University of Virginia before I kind of went out to practice. I did a little general neurology when I first started practicing, but mainly I just do sleep now. But with sleep medicine, there's a pretty big overlap with things like headache and dementia and Parkinson's disease. And the specific topic of this podcast is headaches that seem to be mainly occurring at night. So we're looking of the umbrella of headaches, and you can see if you're watching on the YouTube page, I'm wearing my vintage headache t-shirt here. So we're looking, sort of in this area right here for the headache. So basically, we're talking about nocturnal headaches. And there's a lot of reasons why headaches might be able to find a home at night. There are a lot of carbon dioxide changes during sleep. So our breathing is fundamentally different when we're sleeping than when we're awake, especially if you have breathing disturbances like sleep apnea. And with CO2 changes come oxygenation changes, a lot of autonomic tone changes. So the automatic point parts of our nervous system change pretty significantly based upon where we are in various stages of sleep. There's REM sleep activation and deactivation, hormone fluctuations. You get the picture. Just think about sleep as not being a passive entity, but it's a really active, process that's going on during the night. I always like to tell people who say things like, well, I just can't shut my mind off at night. Consciousness may be suspended during the night for most people who are sleeping, but your brain is active during the night. So don't think of it as I've got to turn my brain off. You really want to think about it as I need to shift towards different states during sleep for sleep to be most effective. And when we move to the night, there's some vulnerabilities that might lend themselves to being bit more susceptible to having headaches. Like I said, breathing, oxygenation, blood pressure changes a lot during sleep. Even intracranial pressure, the pressure in our brain, the fluid around our brain, that pressure changes, particularly when we're going from an upright state to lying flat. You can imagine that that might play a difference as well too. So let's go through some different headache classes, and I thought it'd be maybe most useful to divide it up roughly into ages. But I think you have to be very careful with ages because can a child, young kids get migraines? Yes. Can older people get migraines? Yes. Now, there are age predispositions. So we'll take a lot of this with sort of a grain of salt. So when I think of young people having headaches at night, my first thing is migraine, a presentation of new migraines. Typically, I think of this as sort of, younger preteens, maybe girls as they are approaching their first period. That can be a time of great hormonal changes and headaches as well too. But kids, when you look at different kinds of headaches that they might present with, even migraines, don't typically look a lot like adults, or they can look different in the sense that there may be sort of vomiting, cyclical vomiting involved. Sometimes they feel it in their gut. There's the so-called abdominal migraine, confusional migraines where kids act strangely that can be misdiagnosed as having seizures, where they're just kind of absent or confused for a period of time. Sometimes these things can happen overnight, which introduces a lot more complexity because now we're thinking they're sleepwalking, it's a nightmare, it's a night terror. But REM sleep density can be a trigger for some of these kids having their headaches. So we want to evaluate when it comes to headaches in kids. Family history, mom and dad, did they have similar things growing up? Do they have a current headache history? Does light bother them? That's a typical sign of migraines where kids are sort of photophobic. When they're bright light, they want to go to the room, close the blinds, and close their eyes. It makes them feel a lot better. And like I said, the nausea, whether there's vomiting or not, nausea can be a sign of those types of headaches. So what do we do for kids? Typically, it's watch initially, make sure kids are very well hydrated. You might supplement with magnesium. Very important to make sure that they're on a good sleep schedule. So you can imagine there's a lot of reasons why somebody might come to see me. Sleep apnea in children is not as uncommon as you might think, and the criteria for diagnosing sleep apnea is a little bit different than what we'd see in adults. This is clinically something that is often very much missed by practitioners and often presents as a morning headache. Kids are waking up, they don't feel good, nausea can be a part of it, they've got a dull headache, I don't want to go to school. If they rest a little bit longer, if they get up and go, usually within a couple hours, that headache goes away. You want to consider this in kids, but also adults who snore. ADHD diagnosis is often common in these kids, mouth breathing. That mechanism is, as you can imagine, as they're having trouble breathing throughout the night. Yes, they're not taking in oxygen the way they should, but they're also not releasing or getting rid of carbon dioxide. So they have a bit of carbon dioxide retention, which can be measured during a sleep study. So the solution for kids is typically tonsillectomy, adenoidectomy. Some sort of home sleep testing is often going to be required prior to that. Have kids been put on CPAPs or undergone surgeries for other kinds of surgeries for sleep apnea? Yes, maybe even oral appliances based upon things. We had a kid many years ago who had a significant overbite and their jaw was really kind of pushed backwards, large tongue. So the surgical correction was to break the jaw, move it forward to give that airway a bit more space. So sometimes the cure for the headache is fixing the airway. There's a lot of people that think about airway as in a relationship to not only sleep apnea, but other kinds of signs and symptoms of medical illness like headache. Night terrors can often be mistaken for headaches. The kids are confused. That arousal can be sort of a diagnostic dilemma as well, too. Again, sleep stabilization is very important. As we move to the teenager or the college student, sleep schedules can be a real problem. Inconsistent sleep schedules or inadequate sleep can often lead to feeling poorly the next day, feeling having trouble with sleep apnea. A big one with this age group is the caffeine withdrawal headache, staying up late, using energy drinks or Zen or something to stay awake. So they get up and get going. Their body is gone without caffeine through the entire night. So they're starting the withdrawal process. So by the time they wake up between 6 8 o'clock and go to school, they get to school, their brain's like, where is the next caffeine? Well, they can't have it because they're sitting in first period, not allowed to have Red Bull during their history class. So as that caffeine withdrawal kicks in, they start to have the headache. So as long as the teenager or adult is able to continually hammer themselves with caffeine, they do okay. When the withdrawal happens, that's when the fun begins. And we talk a lot about adenosine when it comes to caffeine. Caffeine blocks the effects of adenosine on the brain, so that plays a central role in the headaches as well too. So when you couple in a little bit of bad sleep timing and some dehydration, you can make things even worse. So it really becomes getting a realistic view of how much caffeine somebody is consuming, looking for consistent wake time, and moving forward from there. So let's get into adults with cluster. And you can put migraine again with the teenager because that's generally when they're going to start. The producer of this podcast had migraines when she was in middle school. Photo flashing kind of lights could have really devastating headaches. These were not necessarily nocturnal headaches, but some people do get them primarily at night. When you're looking at adults who are waking up with headaches, the classic board exam question is the cluster headache. Cluster headaches typically wake people up at night. Generally, one side of the face or head is involved. Very severe stabbing unilateral pain. And the classic tip off for the cluster headache is autonomic dysfunction. So eye tearing, nasal congestion, nasal running goes along with the headache. And they can have really interesting, a lot of the treatments we use for headache and migraine go along with this, but cluster headache actually is something that can respond to oxygen. And we were talking about Harry Swain with the Broncos. There was a running back, I think it was Terrell, I want to say Terrell Owens, that had cluster headaches. Can't remember who it was. And I remember during certain like Super Bowls, he would have to go off during the the game and get oxygen in the locker room. I don't remember, God, I can't remember who it was, but I wonder if I'll have to look that. It was Terrell Davis. Terrell Davis I bet was on the team with Harry Swain. I'll look that up and we'll confirm that, but I think he was. And he would have to leave football games, go get oxygen therapy for his cluster headaches, and then come back into the games, which I think was a long time ago. So I'll confirm if those two were on the same team. Migraine, we've talked about auras, flashing lights, sometimes complicated things where you're neurologically unable to, speak or something like that. So waking up in the middle of the night with a complicated migraine could often be mistaken as a stroke, which can be very scary for a lot of people. Tension type headaches, much more common in adults with stress. So a lot of times those things can manifest themselves when they go to bed at night if they're still kind of stressed from the day. Usually rest and relaxation helps that. So these are things that are typically going to wake somebody up during the night. Generally speaking, when they wake up in the morning, that's the probably the least stress that they've been because they've been relaxed all night long. Another very unusual type of nocturnal headache is the chronic paroxysmal hemicrania, very short, frequent, sort of intense bursts of pain. These are often very sensitive to a certain medication. We were always taught indomethacin. You give indomethacin, and typically people with chronic paroxysmal hemicrania just get significantly better. These can occur predominantly or almost exclusively at night, often waking people up. And it's really important that this group, if that's what you're suspecting, the chronic paroxysmal hemicrania, that we distinguish those individuals from hypnic headache, which I'm going to talk about in just a second, is a headache that predominantly affects older individuals. Some key aspects to chronic paroxysmal hemicrania, they call them, sometimes alarm clock headaches because people wake up like cluster headaches at the same time every night with this headache. Symptoms are intense, sharp, typically one-sided pain. That's where the hemicrania comes in, lasting about 2 to 30 minutes. Sometimes they can get associated eye redness, tearing, nasal congestion, even pupillary changes similar to individuals who have cluster headache. Treatment, they often respond, like I said, to the drug indomethacin. That was sort of not only the treatment for the disorder, but also a diagnostic. Let me give you some indomethacin. Oh my gosh, it went away completely, probably having CPH. And again, you probably differentiating them from cluster headaches and hypnic headache, we'll talk about in a minute. Classic headache we cannot fail to mention, particularly in adults, but you can see it in kids, is obstructive sleep apnea syndrome. Individuals, as they sleep during the night, are closing off their airway. They're unable to take in oxygen, but they're also unable to remove carbon dioxide. So that buildup of carbon dioxide, when that individual wakes up, causes the headache. It's like, and you can create your own sleep apnea headache, even if you don't have sleep apnea. Just get into bed and pull all the covers and duvet over your head. And if you've ever done that, you get all the way under covers, and after a very short period of time, things get stuffy, and it's like hard. You feel like you can't really breathe really well. Yeah, because you're rebreathing a lot more of your own CO2. And we used to do studies in individuals by giving them, we put a mask on them and give them a little bit of extra CO2 to get their blood vessels to respond in a certain way, to test vasoreactivity in the brain. It would often cause a little bit of a dull headache when people were breathing it. So again, it's a morning headache. You wake up with it, it's dull. If you do nothing, it generally gets better fairly quickly within the next couple of hours because what's happening as soon as you wake up, the obstruction's gone. So now you're breathing properly, you're enriching your blood with the oxygen, you're breathing off all the CO2. So the thing that starts the headache is gone as soon as you wake up and become conscious. So again, it's that hypercapnia causing the the headache. And the headache again, one of the best things about treating sleep apnea with a CPAP, or however you should treat it, but you give somebody a CPAP, what two things happen quickly? People stop waking up to go to the bathroom quite as often. That's something people tell you almost right away. I started wearing the CPAP and I haven't gotten up to go to the bathroom more than once since. Before that, I was waking up 10 times to go to the bathroom, right? Because your airway is obstructing and you're waking up to prevent yourself from suffocating. But the other thing that's going on is when you're wearing that CPAP, now all of a sudden the airway's open and that exchange of oxygen and carbon dioxide is working perfectly now. So a lot of people will come in never having complained about a nocturnal headache. They get the CPAP, and the first thing how's the CPAP going? Oh my God, it's great. I think I've had a headache for 7 years and I didn't really realize it because now I'm waking up without the headache. Another one that we've talked about, I don't know if we've ever done an episode on it, but we really should. In fact, I'm writing it down right now, is bruxism. I feel like we have. I kind of remember looking around for a song that had something to do with grind, but bruxism is grinding your teeth. Very underappreciated. Most people are you can brux during the day, like if you're anxious. Was talking to my son who was doing some long distance flights where he had to be the wingman, like the literal wingman for some other naval aviator. And so when you're the wing person, all you do is look at their airplane and make sure your relationship and attitude to that airplane is exactly where it's supposed to be. They're flying, you're trusting them to get you where you need to go. You're just making sure you're kind of cuddled up right next to them wherever you're supposed to be. And after this, hours and hours of doing this, he said, "Oh my gosh, I've got my jaw is really sore." I'm like, "Yeah, because you were probably like gritting your teeth the whole time because you couldn't put the put the old naval aircraft on cruise control. You had to be perfect. It's like when do you ever like drive your car, and this is always seems like at night, and they've closed off the shoulder because of construction on both sides. So now you're driving your car down what feels like a chute, and you have no ability to drift left or right because you'd run into some concrete barrier or orange and white cones. Yeah, so you stiffen up. And when you do that, you set yourself up for jaw pain like he was experiencing, or potentially waking up with a headache. Because think about your masseter muscles up here, your masseters up here, and your temporalis is up here. You're clenching those. So all these muscles of mastication can wake up and make you feel sore and give sort of a dull headache. So making sure you're preventing teeth damage and bruxism, but there's also things you can do to relax the muscles if you do it a lot to prevent those headaches. Medication rebound, alcohol, all of these things can certainly do it. Over-the-counter sleep aids like antihistamines, dehydration, analgesic rebound, all the things we talked about with young people are certainly in play for older individuals. Hypertension is another sneaky one. We typically have a very natural early morning surge of blood pressure. So when blood pressure levels aren't where they should be, this can be natural. This could be because you've taken your blood pressure medication at 7 p.m. the night before and you haven't had your blood pressure medication and now you're waking up. Blood pressure can be doing kind of weird things. Most people are not taking blood pressure medications throughout the night. So anybody having morning headaches should be doing some pretty regular blood pressure checks, not only in the morning, but it points throughout the day and before you go to bed to give a comparison. Is that morning blood pressure higher than what your baseline level typically is? And one's not enough. You really want to check that blood pressure over and over so you get a good sense of trend. So older adults with headache, older adults with new onset headache, this is where we have to be very careful as clinicians. I have a rule in my clinic. If you're having a new onset headache, or you're having a change in your headache character, you probably need to work up and you probably need some sort of imaging. If you're like, look, I've had a whole, lifetime of migraines, they're always the same, have about two or three a month, sometimes around my cycle, nothing's changed. You don't need to get a neuroimaging for all those things. But if there's ever a change in the character of it or a new onset, I think we need to. So we talked earlier about cluster headaches and paroxysmal hemicrania. I wanted to reference the hypnic headache, which is a lot more common in older individuals over the age of 50. The classic hypnic headache, same time every night, set your watch to it, older adults. These headaches often respond pretty nicely to caffeine prior to going to bed. And we also want to make sure that when you're looking at headaches, particularly in individuals over the age of 50, the one-sided headache with, you know, tenderness around the temple on the one side, we never want to be fooled by temporal arteritis or giant cell arteritis. This can be a medical emergency where individuals can have a vasculitic change of the blood vessels that could actually affect the eye and could lead to blindness if not treated appropriately. Very easy to work up, simple labs, a SED rate. So anybody who's, experiencing like really, it's always on the right side and I have a lot of pain in my temple, even if it's happening at night and has other signs of like a hypnic headache. Want to make sure you're being worked up for that temporal arteritis, giant cell arteritis. So, red flags that we think about with these headaches, what's taking you from concern to emergency. I think headaches that wake you up in a lot of pain suddenly in the middle of the night, particularly if the worst headache of your life, this might be a medical emergency that requires attention in that moment. So urgent attention anytime you're waking up with a headache or having a headache that's causing a lot of vomiting, neurological defects. So beyond just feeling like crap, slurring your words, vision in one side of your facial droop, weakness in one side, sensory changes. If it's getting worse and worse, that it's progressing. We want to be very careful at that. And any kind of personality change, if you think the individual is behaving strangely, this is go directly to the emergency room and do not pass go. Because the other thing we worry about outside of something like temporal arteritis is some sort of expanding mass lesion in the brain. The brain is a soft little entity, little organ that sits inside a hard immobile skull if you're an adult. If you're a kid, you can little babies can their skull's a little malleable, but for an adult, if there is a mass or a bleed or some sort of thing causing increased intracranial pressure, as that pressure rises and pushes against the brain has nowhere to go. Have you ever smacked like I've got bizarre shins. Next time you see me, I'll show them to you. It feels like my shin bone, A, perfectly flat, B, is right underneath the thinnest layer of skin. You feel like there is nothing separating your finger when you touch my shin from the actual bone. There is no flesh over the. So anytime I hurt my leg there and there's swelling, if you smash your arm, you get a bruise. Right, because the bruise is swelling, but it can kind of move inward. There's nothing here preventing that swelling from going in. There's subcutaneous tissue, there's fat, there's, whatever. There's a lot of distance between there and the bone. When you smash your shin, there is nowhere for that bruise to go inward, so it's this massive lump on my shin that looks like somebody sticks it's like a marble or a golf ball under my skin because it can't swell. That's exactly what's happening with your skull. As the brain swells, it's got nowhere to go, and bad things can happen. It's what we call herniation, where now the brain starts to squirt itself through any little hole they can find, and that is a very, very bad sign. That is a massive medical emergency. So for kids, any headache that's waking kids repeatedly, morning vomiting, changes in their pupils, that again, do not pass go directly to an emergency room. So the things also, like we said, we worry about anybody with new onset headache who's over the age of 50. That's always concerning to me. That person's going to get a lab workup, a SED rate, maybe neuroimaging, and any cancer history. You want to be very careful about that as well too. And the other thing I will lead you, this is the a neurological thing that they kind of beat into you when you're in training, what we call the thunderclap headache, the headache that comes out of nowhere. Now, this can happen during the day as well too, but if you wake up or your partner wakes up with a sudden headache that is the worst headache they've had in their life, that, my friends, is an aneurysm until proven otherwise. That is a rupture. That again is a medical emergency. Please get that person to an emergency room as quickly as you can. Uh, Sleep medicine does not trump neurology in this situation. And there's a lot of really bad things that can happen neurologically to an individual. So I'm trying to describe that as well as I can as a neurologist on paper, but not somebody who practices and does a lot of these types of things. But that there's no excuse for us not to be ready when we see them. So, how do you evaluate these individuals? We're going to screen for snoring, screen for medications, screen for caffeine, screen for sleep schedules, etc. The MRI is not always needed or some sort of imaging, but I do think at times it's necessary, not only for what we're talking about when it's a new onset, but also when somebody's concerned. I mean, there's definitely a great feeling that I can say when you say to a person, listen, we've done the MRI and that's fine. So we can all take a deep breath. We still have to get to the bottom of what's causing your headaches, but there doesn't seem to be something that's terrible or deadly that is looming right now. There's no mass, there's no Mets, there's no aneurysm, there's no blood, etc. Most nocturnal headaches improve vastly by fixing sleep. That can be more regular sleep schedule, better pillow. And next week is the second annual Sleep Unplugged pillow fight. So you're going to have to tune in and check that out because maybe the pillow is what's causing your neck to be pinched and you'd have your headache. So we want to treat sleep apnea when we find it, hydrate, maybe potentially magnesium trial for some people, indomethacin if we think it's paroxysmal hemicrania, more consistent sleep, wake times, etc. Parents, don't ignore snoring in your young kids and adults. Don't ignore that blood pressure. So, when pain invades your sleep, the brain is asking for some attention. Let's give it to it in the most productive and proactive way that we can. I hope these are somewhat helpful to you. If you've had experience with nocturnal headaches, please let us know. Dr. Chris Winter Instagram, Dr. Chris Winter Twitter, Dr. Chris Winter Blue Sky Threads. We will get everything ready, get your brackets ready for next week's Sleep Unplugged Pillow Fight 2026. We have 16 brand new competitors, which is really exciting because we made a rule you can't enter the same pillow twice. So you're going to really want to tune in next week to hear what 16 pillows we've got for you. They are all spectacular, and you're going to have a fun time with that episode. So until next week, sleep well.